I'm off now, and I'm taking the car.
Morning, Rachel. Morning.
Morning. Oh, nice lycra.
Sorry, I didn't have time to change. Good to see you two are raring to go.
Yes.
Yeah, Rachel's on her way. I've just passed her jogging with a cigarette.
Great start.
Speaking of changing, here's your fat suit, Sally.
I thought I was fat enough. Clearly not.
Let me just get out of this stuff and get set up.
Sorry, I'm late.
You all right?
Yeah. Ooh, 2 cameras. Very professional.
Oh, yes, darling. That's for our close-ups, don't you know?
Couldn't you find an actual obese nurse, Hugo?
Well, I guess that would have been difficult. Hey, you're fat. Do you want to star in a film about fat and unhealthy nurses?
Something like that.
Hey, do I get to wear one too?
No, Sally's acting someone else. It's based on a load of interviews I did with a load of other nurses. But you kindly consented to tell your own particular story for the film. Is that still okay?
Yeah.
And I get to do my big confessional about smoking.
Yes, thank you.
I'm not going to be able to do anything in this.
Well, I think that is the point, isn't it, Hugo?
Exactly. We know 1 in 4 nurses is obese now, and that obesity is the 2nd biggest cause of preventable cancer after smoking. So nurses should know. Sorry, I meant to keep my opinions out of this.
Oh, no, you're right. I know loads who can't even bend down to help a patient put on their shoes.
Says Miss Skinny.
I know I've got a spare tyre, but mine's more mini Clubman. I mean, this is a ruddy great trot. Look at this. I'm exhausted already.
And the good news is you now have to put it on under your uniform.
Excuse me.
Yeah. While we're waiting, I'll just reframe and let's try the intro. Well, thank you all for agreeing to be part of this research film project. As well as the video diary camera in your homes, I'll be filming you out and about for a few days of your lives, just to see what stresses and strains.
We can show you plenty of those.
Of course. And importantly, the obstacles, the cultural phenomena that prevent you and so many of your colleagues leading healthier lifestyles.
Well, where do you want me to start? Nurses are shat on, well, literally, on a daily basis.
Josie, I can't use any of that now, can I?
Ta-da!
So, what kind of a study is this then?
It's called ethnography, a study of a particular group, in this case, nurses. I'll be recording your behaviours in certain situations, at work particularly, but also at home, so that the powers that be can possibly implement some changes. But as importantly, I hope you as individuals and your colleagues will be inspired to make some changes too, which will come up with our group discussions.
Good luck with that. I'm no expert.
I'm starting from the premise that hospitals and other medical settings are not in themselves obesogenic or
Obese
inherently-
what?
Sorry, tending to cause obesity. My point is, if these environments were obesogenic, unhealthy, then why aren't physios and doctors also obese? I mean, you know, just for example.
Right, so where do I start? Doctors and physios can walk away from the patient and the ward. Our relationship with patients only ends when they are discharged or die. We are left to pick up the pieces, so it is no wonder that our health gets abused. And do not get me started on how we are treated on a day-to-day basis. We don't get breaks.
Okay. Yeah. All right. Just straight to camera then, please. A little bit about how you got into nursing, just everyday lifestyle. Use your own story for this. It's just to get you used to being filmed.
Are you sure? Once you get me started, I might not stop. Well, I trained at Southampton General way back in, well, we're back in the days of bed inspections, wearing awful American tan tights and smuggling your boyfriend in and getting him to pee in a milk bottle. Yeah, we put on a few pounds. I mean, even the dressmakers then that made our uniforms, they said we'd be back for larger sizes, and we were. It was all treacle sponge and custard in the night canteen, because that existed then. And I even remember once, we were finishing off someone's milk tray as we were laying them out. Oh, do you know, patients still don't give nurses healthy stuff like fruit. They should put a sign up saying, please don't feed our nurses unhealthy snacks, like at the zoo. Oh, yeah. And after years of yo-yo dieting, I've been on the ice cream diet. That was a lot of fun. The fibre plan, that wasn't. Oh, yeah. And at my age, well, there's no hope for me.
You're only 59, Sally. Hardly old.
Yeah, but...
Yeah, but?
I know.
Right. Can you start reading the script now? This is based on an interview I did with a lovely senior nurse practitioner up in Manchester.
Oh, I worked in Manchester. I love it there. I remember I was on this home visit one. Right. Anyway, I'm in the community now, regular hours, but I can still grab food when I can. Is this all right? My car's my canteen now that I'm out and about. Do you know, this is so me. My car's a skip. I empty all the wrappers on a Sunday night, ready to top them up again the next week. Disgusting, I know. I've got no time for food prep, though. And, you know, I reckon I keep all the local 7-Elevens in business. It's dreadful when you come to think of it.
Sally, this is your own life again, isn't it? Can we get back to the script?
Sorry. And my husband doesn't cook either. Nor mine, though. Do you know, if he's heating up last night's biryani takeaway, he thinks he's won MasterChef.
Script.
Sorry. Weekends, we'll take my mum to a garden centre for an all-you-can-eat Sunday lunch. She's had breast cancer now, so I think every day's precious with her. Bless. We slob in front of the telly a lot, picking really. Then it's back to Monday and we do it all again.
Script, Sally.
And it's difficult to change the nature of a nurse. We are pre-programmed to put others first and just eat. I do feel bad though. Well, even earlier today I was making every contact count, giving our spiel to this chap. And this is just me today. I was making every contact count. I said, Tom, do you know, it would really help your fitness as well as your loneliness if you say swam, walked 20 minutes a day, 5 times a week. We'll give you an extra 2 to 4 years with your grandkids and a reduction of 20 to 40% on up to 22 diseases. And he gave me that look. Yeah, it says here too, he gave me that look. I know that one, because I'm no role model. Probably carrying around with me a 4-stone alien with me each day. I blame mine on that first box of Terry's All Gold on Wilson Ward. But how do you undo a lifetime of bad habits? I really got into that one. Was that all right?
Thank you. Great detail.
Oh. Hi, love. Stroganoff for tea.
Baby step.
So, I'd like to hear from you guys today. What are your ideas to help your fellow nurses be healthier?
Improve morale. No one believes in us, so we don't either.
Yeah, we all know about input and output, but it's very difficult when you're exhausted and not valued to value yourself. Stop fat-shaming nurses. We need more open, supportive discussion.
It's true. I mean, we all talk about death, don't we? But fat is our taboo.
So many of us secretly just want to lose weight.
And then it's nights and we order in pizza.
Why?
I'm joining in.
Comfort.
Can you put your own health needs first? Create a different culture, dare I say?
Well, it's difficult to make change without a specific motivation.
Being health messengers for your patients isn't motivation.
In my experience, people will do hard things if you help them to.
So how can we help?
Well, get management to sort out the franchises. Only allow them to serve healthy food.
Sally?
Well, I'm so busy starting then failing on diets, I'm no expert.
Oh, this isn't a diet, but...
Oh, well, actually, Lucy made us all this amazing omelette on last night's in minutes.
Okay, so simple changes then. What about a fitness programme?
I love Bollywood. Well, I've certainly got the equipment for it.
I found it. It's an app. Nursing You, it's called. The WIN Project. Healthy Weight Initiative for Nurses. Shall I sign us both up, Sally?
Would that work, say, for you, Sally?
Seize the day. These are going in the bin.